Good morning, Labor, Health and Social Services Committee. Welcome to the first of our committee meetings for 2024. To start out, we'll normally call the roll as soon as I introduce our committee secretary, Barb Austin, new to our committee this year. Also like to point out Kimika in the first row. She's our labor health intern. So if you need any research for the next 3 weeks, she is interning for us. And with that, if you'd call the roll, Barb.
Representative Chadwick.
Here.
Representative Clouston.
Here.
Representative Hornick.
Here.
Representative O'Hearn.
Here.
Representative Penn.
Here.
Yes. Representative Trujillo.
Here.
Representative Ward.
Here.
Vice Chairman Yin.
Here.
Chairman Zwanitzer. Thank you.
Thank you. We're all present. Due to the Management Council rules, I would like to take a minute to go through the opening decorum script with everyone in the room. I know most of you are old pros at this, but for anybody new, we do have copies of the decorum rules located in hard copy outside the door and also available on the legislative website. It's a simple reminder that we expect some civility and decorum at each one of our meetings, to let you know that our meetings are open to discussion of all viewpoints, and it is our place to ensure everyone can express their opinions free from abusive or distracted behavior. How this works is you will address your comments through the chairman by Mr. Chairman, and we will then send comments to the appropriate legislator or witness. Comments must be to the issue under hand. Speakers will avoid criticism, ridicule, or name calling at anyone in the meeting. And please do not speak over another person who has the mic, carrying on distracting conversations in the back of the room, or shouting, clapping, or booing at any speaker's comments. With that, committee, we have 2 bills up today. First up is prior authorization regulations, House Bill 14. We spent a lot of time in the interim on this bill. There are 2 amendments coming, which I'll speak about. I'm going to turn over management of the committee to Vice Chairman Yin so I can present House Bill 14 for the morning. So take it away, Vice Chairman Yin.
Thank you, Mr. Chairman. So we have House Bill 14 under consideration, and if you would like to speak from dais or up front, please take whichever stance you would like and start explanation of the bill for us.
I'll make it quick then. All right. Good morning, committee and Chairman Yin. Thank you for allowing me to be here to present House Bill 14 prior authorization regulations. This is our kind of main priority interim bill, as you'll all remember, and we've spent many hours on it. Representative Penn did the bulk of the work at a meeting, kind of a pre-meeting before our first crack at it in our first interim meeting. There are kind of a cleanup amendment from LSO and a more significant amendment that I think all of the major affected players have worked on for the last 3 months that they will be presenting. As such, I'm going to quickly go through the bill, knowing that there's some amendments are coming. And so I'm certainly happy to answer any of your questions. But because some of the amendments do change up some of the concepts and the wording, you can certainly wait until those amendments are presented. So quickly, this is going in Chapter 55. It's new language going to our bill in 2655-101. We normally don't put legislative findings in bills, but we did in this case in 2655-102 there on page 2, put in 2 legislative findings that should this go before a court or have issues that we are saying as a legislature, the patient-physician relationship is paramount, and that our prior authorization programs are not permitted to hinder patient care and intrude on the practice of medicine. Everything from page 2 through page 6 are definitions. Happy to talk about any of those in more depth should you want to, committee. But the meat of the bill starts on the bottom of page 6 when it comes to disclosure. You'll see that any disclosure on prior authorization requirements need to be easily accessible on a website, need to be posted there within 24 hours. Health insurers or contracted utilization entities shall not implement new requirements or restrictions unless they've been updated to their website. Written notices of any changes in plans need to be within 60 days before. And the Department of Insurance is going to promulgate some rules we're allowing on page 8, making some of those statistics available to the public. You can see on pages 8 and 9. We're then further detailing the people who are allowed to make adverse determinations in 2655-105. Primarily, these have been made by a physician. You'll see on the bottom of page 9. In 2655-106, we are requiring consultation that health insurance shall notify enrollees, healthcare providers that the medical necessity is being questioned, should there be an issue or a conflict. And then you'll see we have an appeals process in 2655-107 and the requirements applicable to those people reviewing appeals. Primarily, they need to be reviewed by another physician or someone with sufficient medical knowledge in that area on the prior authorization. That runs really all the way through page 13 when we're talking about the obligations. On the middle of page 13, you'll see that those determinations are within 5 business days of obtaining all necessary information to complete the review. Furthermore, in the obligations, they're in 2655-109. And on to page 14, they shall be notified within 24 hours after receiving all necessary information to complete that prior auth review. Thank you. Moving over to page 15, and again, I'm going fairly quickly because I know we've spent time significantly in the interim, so I'm trying to hit the high points. 2655-111 on page 15 on the length of authorizations are being valid for a year. And there's some stipulations on some of those drugs in the schedules. Jumping to page 16 on continuity of care. Again, it's not less than 90 days after their plan commences. So those are kind of the big dates in there we're going to talk about, I'm sure. Moving on to page 17, changes in coverage. On criteria, it's a year before the effective date on the change. You'll see that in line 6 and 7. Moving on to 2655-113 on provider exemptions. I mean, it goes through all the provider exemptions. There's some significant changes, but they're primarily in a 12-month period. And I know some of the amendments tackle on to that section there. So we'll discuss that more in depth, I'm certain. That really covers the bill. Again, we are giving the Department of Insurance on page 23 some rulemaking authority to promulgate all rules necessary. Again, we are about the last state to have prior authorization processes in our statutes. And so that's why we've spent a significant amount of time this year putting it in the statute. And then you'll see some effective dates in 2 parts. They're on line 9 on page 23. Everything besides subsection B is effective July 1st of this year. And then you'll see in B sections 2 and 3, so they can start promulgating rules immediately. That's the very quick cursory overview of the bill, Mr. Chairman. There's lots of people here to testify behind me. While I do have the mic, I would like to present proposed amendment number 1.
Please.
And this was some catches from our LSO staff, primarily regarding when we say professionals or physicians in the statutes, we really mean providers and healthcare providers. So we've had this talk many times before about physician assistants, nurse practitioners, people with that authority. And that really is amendment. It was an LSO cleanup as they went through the bill to make sure it conformed with our statutes. Amendment number 2, I'm sure will be presented by others in the room behind me. But at this point, I am happy to answer any questions you may have, committee.
Committee, any questions for Chairman Zwanitzer? Well, great job, Chairman Zwanitzer. So let's bring up the main stakeholders of the bill first. So this is a public comment period, but I want to bring up the main stakeholders first. Let's bring up the insurance providers and the folks from Wyoming Medical Society if they would like to speak first.
More chairs, I suppose.
Yes, definitely pull up more chairs. More chairs. Seems like there's quite a few of you.
Everybody's gonna take a chair and no one take a mic.
Solidarity.
We used to have committee room 5. I don't know what happened.
Well, it seems like the mic is centered over Ms. Bush, so I feel like you want to start there, so go for it.
Good morning, Mr. Chairman. Sheila Bush with the Wyoming Medical Society. And I'll defer my time to Eric Boley here at the beginning.
Mr. Boley, please.
Well, happy Valentine's Committee. Mr. Chairman, committee members, I'm Eric Boley, President of the Wyoming Hospital Association. And we just have a brief starting point here. I would say this is probably the most significant healthcare bill this session and probably in many years. It's a culmination of good, hard work, hundreds of combined hours of meetings, back and forth and compromises. Prior authorization is a huge issue, not only in our state, but in the country. It's become more apparent to me during the past 6 months as my family has dealt with prior authorization issues, and the frustrations are real and it's difficult. When you're sick or hurt and you need to get help, we need to remove barriers. I'm lucky because I live in this world. I've spent 30 years in the healthcare world, but there are others that don't have that luxury and don't understand the ins and outs of insurance. And prior authorization is challenging what I believe is tens of thousands of people on an annual basis. The bill is a great start to a complex and growing problem. We're grateful for the hard work and collaboration we've had with this committee, especially with Representative Penn, Representative Clouston, Chairman Zwanitzer, and Senator Dockstader that have gone above and beyond. We've spent a lot of time texting and emailing and calling in the interim. We as a group have met for hundreds of hours since our last meeting in Saratoga cumulatively to come up with what we think is a really good start and a great bill that will address the prior authorization process. And with that, we'll take any questions.
Any questions for the Hospital Association? Great, thank you, Eric. Please, whoever wants to speak next. Bruce? Mr. Spencer?
Mr. Chairman, Bruce Spencer representing the Mountain Health Co-op. I just want to agree with Eric's comments. It was a lot of hard work and it was not easy work. While we are all professionals, it was difficult, hard conversations that result in the amendments that you see today. And the amendments are critical to the bill. My client's a very small insurance company, and without the amendments, it would have some difficulty complying with the original bill language. However, the amendments recognize the concerns of insurance companies as well as patients and providers, and we feel they're an excellent compromise and encourage you to adopt them. Thank you.
Ms. Day?
Good morning, Mr. Chairman, members of the committee. Thank you. My name is Heather Roday and I'm representing Blue Cross Blue Shield of Wyoming. Echo all of the comments already made, basically. We acknowledge that there are improvements that can be made in prior authorization. And we have worked very hard on this bill. We also would have a very difficult time with the original bill. So the amendments as presented are necessary for us to make it all work. It is indeed a big lift for us, but we are willing to do so to make things better. Thank you.
You like, please continue. Ms. Burke?
Good morning, members of the committee, Chairman Zwanitzer. I wish I could add something new to what has already been said. I guess I should identify myself first. Denise Burke, and I represent CVS Caremark and Aetna Insurance and related affiliates under that umbrella. I think I would really like to emphasize I think this working group has really shown the importance of compromise. And we have worked extremely hard to come up with what we can all agree upon with the amendment. Like has already been said, without the amendment that we all have worked so hard on, it would be very difficult for my client and its affiliates to be able to comply. The amendment is very, very important. And we appreciate the opportunity to answer any questions you might have about that and maybe the process that we have gone through to get to this point. Thank you for your time.
Please.
And Michelle Mack, the Pharmaceutical Care Management Association, otherwise known as PCMA. I echo what was said. I appreciate all the hard work. And again, the amendments are greatly needed. Thanks.
Are there any questions for our insurance providers? Representative Penn?
Thank you, Mr. Chairman. More of a comment. I just wanted to say thank you all as well,
because I know that there has been a lot of sweat and tears and probably quite possibly blood in some of your discussions. And so I know it's been difficult. And so I just wanted to thank you for the work that you have done for this state as well.
Any other questions? Oh, sorry, please, Representative Warnock, thank you.
Chairman, so I'm asking for a little bit of discussion on the time period with this, a 24-hour that is in the bill. Could we just hear some of that discussion again? Because that's one of the, I know that was one of the sticking points during this process. And, you know, I just want to get an update on that. Thanks.
Mr. Boley, we'll start with you.
Thank you, Mr. Chairman. Representative Hornick, we have an amendment. The amendment addresses that, and I'd like to recognize Sheila. She's been, the Wyoming Medical Center has been such a great partner with us in this, and she's actually ready to walk us through the amendment, which will address a lot of the concerns and get us to the point where we think we can move forward with this bill in compromise.
I think that would be appropriate. Ms. Bush, if you would like to walk us through the amendment, and then we can have any questions for the amendment.
I'm happy to. I'll do my best, Mr. Chairman. Again, Sheila Bush, Wyoming Medical Society. I'll start with Amendment 2. So I think it's the longest of the amendments in front of you this morning. We'll skip to page 6, where I think is the first content amendment, which is the definition of step therapy. This is something insurance were very gracious in allowing us to have a conversation about. It's a small piece of step therapy that we're putting in this bill, but really critical. So this is a definition in order to address it later in the bill, which I'll cover in more detail. Moving on to page 10. This is where insurance through the process expressed a deep concern over consultation prior to denial. And so the compromise that we landed on was a consultation after an adverse determination. This essentially codifies the peer-to-peer process. Many insurance companies already do this, some don't. We thought that a consistency in statute would be really helpful. And so essentially what this means is if a provider is issued an adverse determination, if they request a consultation with a peer, then the onus shifts to the insurance company for a 5-day business day calendar, or 5 business day timeline in which they can consult and talk with the provider about medical necessity. And a key component of that is that the person on the insurance side has to have decision-making authority. What we hear from providers a lot is in these conversations with some companies, certainly not those with us today, but some companies will allow a provider to talk about the medical necessity and at the end of that conversation say, I'm happy to, put it into the database or talk to someone else. And so it's a very frustrating component. And so one key piece for us was that decision-making authority that you see in the language on page 10. Moving along, you have, I think we get to timelines, Representative Hornock. You're correct. The original language had 24 hours. We compromised to 72 hours. Insurance felt like this was really important. We recognize that there are states around the country who do have a 24-hour turn. In Wyoming, we have small companies. We're proud of those small companies being here. Blue Cross Blue Shield and Mountain Health Co-op being 2 of those who are domestic carriers. They're local physicians. The medical director for Blue Cross is the neighbor across my street. And they very earnestly presented to us that that is not a possibility. It's just not a feasible timeline for them. And we appreciate that. So that's why you see the 72 hours there. And then the compromise then from insurance back our way was shifting that business day that you see for non-urgent to calendar day, which we also felt was really important. Please also stop me as.
No, you're great, Ms. Bush.
Okay.
I very much appreciate it. So please keep going.
Absolutely. So then moving on, we're past timelines. What's that? Oh, thank you. I appreciate that. So then on page 15, subsection A in your bill is being deleted entirely and replaced with language that provides a little more definition, so it breaks it down into 3 subsections. It keeps the same duration for a period not less than 1 year, but divides out 8 outpatient services, prescription drug authorization periods, and then prior authorizations for inpatient services. This was important for honoring and respecting the difference between a prior authorization for outpatient and those services that are provided in a hospital. Moving along to page 16, page 17. This is the gold carding section. Actually, before you get there, that's where the step therapy provision lives. And that is a concern that was raised with the Medical Society. I think you will probably hear more about step therapy in the coming year because of what we discovered and how complicated step therapy even is, and probably the inappropriateness of doing too robust of a step therapy amendment inside of a prior authorization bill. And so we sort of stepped back. But thank you to insurance, we were allowed to keep this one section, which basically prohibits an insurance company from requiring a patient to repeat step therapy if they've previously failed it. And so this happens sometimes where a patient goes through, they're diagnosed, they have a condition that needs treatment, it's often medication, or most usually a medication that stabilizes them before they're able to get to the stabilizing medication that often is more expensive. It is standard practice to go through kind of first-line medications, which we understand the utility of. The concern happens when that patient is stable and they're doing well on those drugs, and then sometimes years later, they're required to go back and repeat the drugs they've already failed. And we think that that's inappropriate and not good for patient care, and so this simply prohibits that. And then, so gold carding is the next section. There's some language, we agreed to remove pharmaceuticals from the gold carding. So this is only for procedures and treatments, not pharmacy or any prescription medications. It provides a provider, physician, nurse practitioner, PA, a 12-month exemption if they do 5 procedures and 90% of those procedures are approved. In a creative, I would say, spirit of compromise, this bill originally said 80% and 5. Our national carriers had great heartburn about 80% being in statute. And so we're at, so we're at 90%. But 90% of 5, if anyone's doing the math faster than I did, is 4.5. And so for purposes of this statute in Wyoming, that would be rounded down to the whole number to make 4. So in Wyoming, I think thank you for the laughter. It's appropriate. So in Wyoming, our standard would still be of 5 procedures, 80% of those approvals. So 4 of those 5 would grant a provider exemption, but it was 90% if it's not a fraction. Okay. Yeah, thanks. And there's some provisions that we agreed to for insurance in terms of look back to avoid incentivizing any sort of bad behavior. And I think with that, I will stop and stand for questions.
Members, I know that was a little bit quick for a lot of content, but please ask any questions you have now, the stakeholders, but we can also bring them back as we work the bill. Representative Warnock, and then we'll go back on the other side.
Chairman, so still with the 24-hour thing. So we talked during the interim, and this was a important piece because we're dealing with in the language of the bill, the definition of urgent care services is something that could affect the health, seriously jeopardize the life or health of the patient. And so this is in relation to urgent services versus a non-urgent type of thing. So obviously it would go through the normal process with the non-urgent, but when we're talking about, somebody with a real serious problem, life-threatening, I remember the discussion being 72 hours seemed like a long time for somebody to sit in ICU waiting for authorization. So curious, because I don't know if that is, it doesn't seem to me like that is every single time that we're dealing with prior authorizations. Those are unique circumstances that you're dealing with the time period, time crunch, I would suppose, you could say. So anyway, just asking for a little more comment about that and why the 72 hours was compromised on in this versus the 24, especially when you're dealing with the potential life-threatening type of situations.
Do you have an answer for that, Ms. Bush?
Mr. Chairman, yes, thank you. I'll give it a first crack, and I'm sure that all of my friends have comments also. I think it's important to remember that that's not emergency. So there's an important distinction between emergency and urgent. And so for emergencies, there is not a prior authorization. People are taken care of, and the right thing is done immediately in cases of emergencies. And so when you move into urgent, we can give the pros and cons of 24 or 72 for a long time. And there's a lot to be said for both. I think that what you have in front of you is a compromise that in some ways is a little fragile. And we'd appreciate sticking with the 72 because truly after what even Eric said, hundreds of hours of compromise, it's where we landed, and we're all sort of unified in protecting what our small sort of local carriers are capable of doing. And so I would rather, I guess I would say I respect and appreciate your comments, and they're not wrong. But I would also say that 72 hours is okay for urgent. It's not emergency. It is just urgent. And it's what we think works for our state right now.
Ms. Bush, and it also seems, I think you mentioned this on page 13, you changed, the amendment changes business to calendar days for the non-urgent services, and that sounded like that was part of the compromise between the 24 hours to 72 hours. Is that correct?
Mr. Chairman, that's correct. And I think at this point, they're all part of the, like, the whole, yeah.
That makes
The
sense.
whole thing is sort of,
The
you know,
package.
it's a package. And so the fact that step therapy, which was really important to us, is in there, is also part of the compromise on the hour turn. The whole thing together creates the real give and take. And so if any piece of that falls away, it pushes 8 other dominoes that are complicated.
Mr. Spencer, Ms. Day, Ms. Burke, any additional?
Mr. Chair, Bruce Spencer with the Mountain Health Co-op. I agree with Ms. Bush. There's a definite distinction between emergency care, which is not subject to prior authorization, and urgent. So Mountain Health Co-op writes insurance in your neighboring states of Idaho and Montana. Both of those states are a 72-hour urgent turnaround, and I have not seen any problems, not heard of any problems in either of those states. And the 72 hours has been in effect for quite some time in both states. Haven't seen any problems with that time frame on an urgent turnaround, but it is an incredibly important distinction between emergency, so life-threatening, you need to go to the ICU. We're not doing prior auth on any of that. That care gets given. So, but I also agree with Ms. Bush. The hundreds of hours that we spent and blood was let is a fragile compromise, and it's all sort of one package, and that's why it took so long, because we were looking at every single thing in this very complicated bill. So I would encourage you to agree with us on our compromise, please. And that's your prerogative. You're the legislature, but we would encourage you to agree with us on our compromise and adopt the amendments.
Mr. Spencer, thank you. We'll take that under consideration. Ms. Day, please.
Mr. Chairman, Heather Roday from Blue Cross Blue Shield. I agree with all of that. I also want to make sure that we're very clear that the Hospital Association and the Medical Society have compromised a lot. And so we, Blue Cross, as our, the domiciled health insurance provider in the state, appreciates everything that they have done. And just wanted to make sure that we were very clear about that. Thank you.
Representative Hornock, any follow-up for that train of thought?
Thank you, Mr. Chairman. So I appreciate you saying all of that. And I remember at the beginning of this discussion, the words agree and compromise were not part of it. So, you know, that's very much appreciated that you guys have come to this point and you're both here at the same table before us, frankly. But just to be clear, so on page 13, we're dealing with business days, and then on page 14, we're just dealing with the hours, even if it goes beyond business days, even if it's over a weekend. Is that correct?
Representative Hornock, so the amendment does change business to calendar. So for across the board, it would go through the weekend. So it wouldn't count weekend days as unused hours. But if you want to clarify, Ms. Bush.
Mr. Chairman, that's correct. So it's calendar days to avoid exactly that, which would be any sort of stop over a weekend or a holiday. The calendar day is the calendar day, and then you're correct, it is hours for urgent. The last piece I would add to maybe give comfort is right now and historically, Wyoming has operated without any timeline requirements. And so, you know, whether it's 72 or 24 or 5 calendar days, it's a drastic improvement from where we've been because there hasn't been any regulation on the timeline whatsoever. And so we think this is an important step and we appreciate kind of the compromise of where we are.
Thank you. Representative Clausen, please.
Thank you, Chairman Yin. First of all, thank you to everyone. I mean, how blessed are we to be in a state where we can get all the stakeholders together and come up with a great bill for our state. So really proud of all your work and thank you. And thank you, Representative Pan. I know what you put into this. You know, as my son was going through school, thinking about the gold carding, he was doing new math. So I think you guys have taken that a step further. So I just want to clarify on the gold carding, the 5 procedures, is that 5 procedures total? I mean, or is it per insurance carrier? Okay.
Please, for the record, Ms. Bush.
Mr. Chairman, Representative Clausen, correct. It is 5 procedures per carrier.
Great. Any other questions from the committee? Then I'll go to Mr. Boley real quick.
Thank you, Mr. Chairman, committee members, Representative Horn. I just want to make sure that you're aware also that in an emergent situation, no matter what, the people are going to receive care. They'll come to our hospitals and we'll save their lives and then we'll figure out the rest of this. So there's no worry that there won't be care for folks that are in an emergent state. We also have just one other clarification on the amendment. We've changed the timelines and you want to jump on it? Or? It's pretty easy. As we met with the stakeholders and as we talked to the insurance companies, the gold carding is a great step in the right direction. We've seen movement nationally on gold carding, especially when it comes to the Medicare Advantage plans. Our state Department of Health has moved to a 90% approval rate for gold carding for Medicaid. But we also realize there needs to be some infrastructure put in place. And so the effective date for the gold carding would actually be pushed out till January 1st of 26. And then the rest of the bill would follow the same timeline that we had in the original bill.
Thank you, Mr. Boley. I think that is good to know for our clarification. Any other questions from the committee? For those in front of us? Well, thank you very much. Again, we really appreciate this and we know that, you know, it doesn't make everyone happy with everything, but compromise is how we make progress in our state. So very much appreciated. Thank you. So anyone else who would like to give public comment, please come up one at a time. And if you want to take a seat next, just so we can move through quickly, each person who wants to give public comment. Please come up. Oh, sorry. So before public comment, we should take state agencies first, and that's my mistake. So please, Mr. Bonenbluss, and then we'll line up the folks who want to give public comment after.
Thank you, Vice Chairman Yin, and thank you for saying my last name so perfectly. I appreciate that. It's Valentine's Day. I was feeling the love all up here, but now I'm feeling very lonely. I don't think I've ever seen where the panel almost outnumbered the committee, so that was very impressive. And I will tell you right now, my name is Kevin Bonenblust. I'm Executive Director of the Board of Medicine, and I will tell you up front, one thing I preach to our staff is that surprises are for birthdays. I don't want to bring a surprise to the committee. I certainly didn't intend to, but I'll get into it. But this is exactly what I brought before the committee in September. And so I hope nobody thinks this is coming out of the blue. Anyway, what I wanted to get at was in this handout, first, I want to thank Representative Chadwick. He's a far better proofreader than I. And so I appreciate him catching where I made mistakes in changing page numbers and lines from the September version to the current. But let me go ahead and explain this. There is oftentimes a real challenge for the Board of Medicine, and that is that if we have a physician, for instance, that's working at a VA clinic and they do something wrong and the Cheyenne patient says, hey, Dr. Smith at the VA did something wrong, please investigate it. If Dr. Smith doesn't have a license in Wyoming, we have no jurisdiction over them. And that's because of federal law that says you can come into any state you want to with a license from any state and practice on a federal reservation. You don't have to have a local license, but then that means we don't have any jurisdiction, which is a real dissatisfying thing for the public. And so it's from there that I'm kind of coming. But what I wanted to explain is that currently, the way the Medical Practice Act is written, and as was passed by the legislature years ago, is that, and you'll see it on this page, it's where you've got the yellow highlight. The practice of medicine includes, and all the black is the original language, renders a determination of medical necessity or appropriateness of proposed treatment. And so that's already in law. So if there's a determination this is not medically necessary, then at that point, that's practicing medicine, and the person needs to be, should be coming under the jurisdiction of the Board of Medicine. If they don't have a license in Wyoming, they're practicing medicine without a license, according to what the legislature's put in here. So what this draft amendment, suggested amendment is it would come in and say, we just add the prior authorization and the language of these new sections to also that is included in the practice of medicine. The idea being then, if somebody, let's say we have an ophthalmologist in Atlanta that's rendering a decision on whether there should be prior authorization for an orthopedic procedure in Jackson, there's some sort of recourse within Wyoming as far as that physician being outside the scope of their training and their skills. And lest you think that as a joke, we see those sorts of things fairly regularly. And so that's the sort of thing we want to address. All that said, and understanding and recognizing that this has come a long way since September, I have spoken with the 8 here of the posse, and I have said I will ask that the committee not act on this amendment at this point, that we huddle among ourselves, figure out how we can address these concerns and not in any way damage the bill or business models. But I wanted to bring this to your attention and also then kind of get it on the radar once again from September. So with that, I'd be happy to answer any questions. But at this point, I would just recommend that you take this and incorporate the knowledge, and then perhaps on the other side of the hallway, if we can get something figured out, we can put an amendment in there. So with that, Vice Chairman Yun, I answer any questions there are.
Thank you very much. Any questions for Mr. Bonenblust? Representative Ward.
Thank you, Mr. Chairman. So just to clarify for the public's sake, you did bring an amendment, but you don't want us to adopt it right now.
Mr. Bonenblust.
Mr. Vice Chairman, Representative Ward, that would be my request. Of course, I can't lobby as a state agency. I'm only suggesting. But yes, I would suggest that you not act on it at this point, but take it as part of the information. It probably is important at this point.
Thank you. Any follow-up? Nope. Any other questions from the committee? Thank you very much.
Thank you.
Are there any other state agencies, just so I don't screw up again, please? Department of Insurance. Name, who you're with. Let us know what you need to know.
Thank you, Mr. Chairman. Commissioner Jeff Rude, Department of Insurance. Committee, we don't have a lot to say on the bill. We're neutral on it. We were there for quite a bit of the discussions. I just wanted to say a couple things so we understand, I guess I'd phrase it, manage expectations. I only have authority over less than 20% of our insurance market, probably about 17. And so when this bill passes, I anticipate getting multiple complaints from doctors about something. The first thing we will have to do is find out what's the plan, because I don't believe doctors automatically know, well, that's a large group plan. Well, if it's a large group, we can't help you. And so that's something we're going to have to work through and figure out. There's actually 950 companies that sell some sort of a healthcare product in our state. I don't know which, and maybe it's probably a project that we should undertake. Of those 950, which do we actually have authority over? So I just want everyone to know that we will do our best. The only other thing I will point out is we will do rules as fast as we can. I would doubt we'll ever get them done in time when this bill is implemented. That will impact enforcement to begin with, because it's going to be difficult to enforce the statute without the specific rules and direction to industry on what they must do. So with that, I'll leave, that'll be my comments, and I'll answer any questions.
Any questions for Commissioner Rude? Thank you very much. Any other state agencies want to comment? Please. Thank you. Please.
Mr. Chairman, members of the committee, Lee Grossman, State Medicaid Agent with the Wyoming Department of Health. I'll keep my comments very brief. You heard from us in the April interim meeting at length in regards to prior authorization and Medicaid. In terms of on this bill, happy to make myself available here for any questions. But the bottom line for the Medicaid program is that by virtue of this law being in Title 26, Medicaid is a public health benefit plan. There's no impact here. And with that, I'd be happy to stand for any questions, Mr. Chairman.
Any questions from Mr. Grossman from the State Medicaid Office? Thank you, Mr. Grossman. Any other state agencies wish to comment? Great. So thank you, state agencies, for letting us know. For those giving public comment, again, please line up at the testimony table and we will take you one by one. Whoever wants to go first. Let's go right to left, from my right. So Ms. Delancey, please start off. You know the drill, your name, who you're with, and what we need to know. Thank you.
Thank you, Mr. Vice Chairman. My name is Cindy Delancey. I'm with the Wyoming Business Alliance, and I just wanted to come before you today and just offer some general comments of thanks and appreciation for the work that has been done on this topic. Moving this piece of legislation forward will just continue to help us strengthen our very fragile medical, hospital, overall healthcare system in Wyoming. Bolstering that is essentially very important to the business community. Having a sustainable medical environment is high on many recruitment lists and discussions. So by moving Wyoming forward and helping us be on par with how other states are treating this, and I was at a meeting the other day where where this was explained, this gap by not having the statutes in place essentially is the Wild West, by kind of giving a little bit of certainty and clarity is certainly in the interest and what my members would like to see as far as public policy. So kudos to the decades of expertise that just were here at the table to be able to work through some of these complexities, the committee members that spent countless hours on this, and hopefully this bill will advance, and we ask for your support. Thank you.
Any questions for Ms. Delancey? Thank you, Ms. Delancey. Hi, please, excuse me.
Good morning. I'm Patty Guzman. I am with Delta Dental of Wyoming. And Delta Dental of Wyoming is one of the 3 domiciled insurance carriers here in the state of Wyoming. A lot of times people don't think of dental insurance because in the insurance statute, we are actually coded under disability. So within all the work that was being done with prior auth, it actually does affect your dental insurance carrier here in the state. And of course, dentists who are providing coverage to all of our subscribers across the state of Wyoming. And so we were not unfortunately part of the discussion of the large group that was up here, but we just wanted to come up and stand in support of the amendments that they discussed with you, because what was worked out between the Medical Society, the Hospital Association, and all the carriers that were up here does work really well for Delta of Wyoming. But I just wanted to stand in support of that and then be here for if there's any questions from the committee.
Any questions from the committee for Ms. Guzman? Well, we thank you for being domiciled in Wyoming, and we appreciate you being able to lend your support to the bill. Thank you. Ms. Herman.
Thank you, Mr. Chairman, Committee. My name is Marguerite Herman. I'm here today as a consumer representative for the National Association of Insurance Commissioners. And let me just say, I showed this bill, the initial bill draft to the various consumer representatives, and they're very complimentary about the balance that has been struck. And then, there are only three very, very small minor changes I would suggest. And they don't impinge on this delicate, very complex, multifaceted compromise that was been put together by the brilliant minds behind me. My position is really just the consumer is not the provider. It's not the insurance writer, but it is the person with the contractual relationship. The one who is paying premiums and has the assurances of coverage, or I hope they understand what's covered. So I'm representing the sort of the middle ground here, not one side or the other, but just a plan that a regulation that assures coverage as promised, as contracted. So just a couple of things. One is if I said before, I think the enrollee gets kind of sidelined in a lot of these things, but actually the enrollee, the consumer, however you want to say it, needs to really be involved in this whole process. And the bill generally does that. There's only one section where I would suggest including enrollee, where it's been left out, is in the consultation that review entity shall, page 10, line 18, shall notify the enrollee's healthcare provider and enrollee. I think the enrollee should be copied in on all the communication that goes on. Really, the only thing in the bill that does not directly involve the enrollee is the gold card, and that is between the provider and the insurance company. Everything else the enrollee should be aware of, should understand what's being denied or approved, why not, how is it being appealed. In one part, the enrollee is responsible for submitting information, documents. So I think everyone along the line should understand what their plan covers, what it should cover, when it's denied, why, and maybe be part of the appeal process to getting things restored. And then the only other thing is understanding, and it does as Ms. Bush said, that we all have to be cognizant of the limited capacity of providers in Wyoming, and looking for the medical person who's going to be reviewing, making the decision. There are two places where it talks about sufficient medical knowledge in a specific practice area or specialty. And I would say instead of specific could be a, podiatrist.
Ms. Herman, sorry, where?
Oh, I'm sorry. Okay,
is that?
so it's the top of page 10, line 1, and then on page 11, line 12. And it's just that to assure that it is not only specific, but applicable. And I would just suggest replacing specific with applicable, because specific is pretty non-specific, actually. So those are the only suggestions I would have. I congratulate all the work that's gone into this, and I think it's going to make a big difference. And as for the first foray into this area of regulation, I think you've done a good job. Thank you.
Thank you, Ms. Herman. So the part about enrollees is actually in deleted language, so we'd have to read in what some of the amendment is if we wanted to insert enrollee there. So just a edification to any of the committee members that if they're considering that, it has to be put into some of the new language that's in the amendment if we adopt the amendment. Any questions for Ms. Herman? Great, thank you very much. Any other public comment on this bill? No more public comment. One more time. Is there any comment online?
There was one person, Mr. Hedges. Let me see if he's still there if you want to talk.
So please admit them and let them turn on their video.
One didn't make me a hose.
Mr. Hedges, if you would like to turn on your video.
yet.
They need to be
There it
admitted.
is.
Yes.
Yep.
You would like to turn on your video and your microphone, introduce yourself, and let us know what we need to know.
All right, can you hear me?
Yes, we can hear you. Please go ahead.
All right, thank you, Mr. Chairman. Ryan Hedges. Used to be CEO of Lander Medical Clinic for 15 years. I just wanted to reiterate that this is a much needed bill. In my 15 to 20 years in medical care, this was by far probably the most comprehensive and difficult situation that my providers ran into trying to treat patients. As you know, it's hard finding employees these days, and the nurses, medical assistants, and that probably spent a significant amount of their time trying to trace down prior authorizations and getting the medications or the treatments that the patients needed. Over those years, if I had to track the time, it would have been extremely significant. So this is a much needed bill, and I ask that everybody supports this bill, and I would stand for any questions if you have any.
Any questions for Mr. Hedges? Nope. Thank you very much.
Thank you.
So it sounds like we don't have anyone else online, and I'll do one more call in person if there's anyone who wants to comment in person. Otherwise, we are closing public comment. Committee, what's your pleasure? I have a move from Representative Clouston, and I heard a second from Representative Penn, I will say. Any comments? The mover, I'll start with you.
Thank you, Chairman Yin. Page 2, line 9, we just missed one. It says the patient-physician relationship. Throughout the rest of the document, we've put in healthcare provider. I'd like to make that change.
So Representative Clouston, that's a motion?
That is, thank you.
Okay, is there a second? So the motion is on page 2, line 9 to change. Can you repeat it, Representative Clouston?
Yes, thank you. So delete physician and put in provider.
So page 2, line 9 would read the patient-provider relationship. That is the amendment. It's moved. Is there any discussion on the amendment? All those in favor of the amendment say aye.
Aye.
Opposed, say nay. The amendment passes. Any other discussion? Chairman Swanson.
Thank you, Mr. Chairman Yin. I had moved proposed House Amendment number 1 before you. Again, this is from our final review from LSO on defining a healthcare provider and then deleting the word professional, inserting that definition of provider, and then at other places on page 8 and page 9, changing that language to healthcare provider instead of just physician. In the case of, again, physician assistants, nurse practitioners, et cetera, who have some abilities in this area.
So that's a motion by Representative Swanitzer for, I believe, proposed amendment 1, and a second by Representative Chadwick. Is there any discussion on the amendment? All those in favor? Oh, Representative Hornak, please go ahead.
Could you just explain why? What's the difference between the two?
Chairman Swanitzer.
Sure, Mr. Chairman. Well, the difference, and we've done this other places in statute the last couple of years. Many places in our statutes just say physician, but certainly physicians, assistants, and nurse practitioners can order medical treatments in this realm that would require prior authorizations for various physical and mental and pharmaceutical needs. So that's the change there. The other change LSO caught, I didn't mention, was on page 10 after line 9. When we just discussed, you have to have a person qualified to make a determination. Really, all it says right now in the bill was they had to have knowledge in the area and specialty, but it didn't say anything about, they probably should know the actual person who in question, some information on their medical history, and what their diagnosis is. So you have to make sure they have that information before they make a qualified determination. And so that was the other catch LSO put in.
Follow up, Representative Hornock? Nope. Any other questions, Representative Penn, on the amendment?
Thank you, Mr. Chairman. I'm wondering if it's a friendly amendment, if this is the place. We heard testimony on changing specific to applicable. I see that in this amendment, it does say applicable on what we just discussed, page 10, line 9. Would it be friendly to change the specifics and applicable that was previously discussed by Mrs. Herman?
So Chairman Zwanitzer, I'm trying to look up where
On specific practice area, in an applicable practice area.
the top of page 10 and the middle of page 11. So line 12 on page 11 and line 1 on page 10. Is that friendly, Chairman Zwanitzer?
That's a loaded question, as this amendment really came from our good attorneys, but so I don't want to confuse the two, but that would be appropriate if the committee wanted to put applicable. I'm not seeing a red flag right away, and no one in the audience has given me the death glare, so I'll say it's friendly.
So, Mr. Chairman, I also need to know from the second, Representative Chadwick, if that is appropriate.
Yeah, I'm good.
Great. Okay, we'll call that a friendly amendment. We'll add that. You know what to do. Great. All those in favor, oh, please. All those in favor of the amendment as amended by the friendly amendment, please say aye.
Aye.
All those opposed, nay. Amendment number 1 is adopted. Thank you. So any other amendments or discussion on the bill?
Mr. Chairman, I suppose if no one else is, I will move proposed amendment number 2. And again, you heard that presentation from the 8 people before you on all 4 pages of that amendment. And so happy to offer any additional commentary, but I would move the amendment at this time, listed as 4302 in front of you.
I heard the second from Representative O'Hearn. So the amendment, proposed amendment number 2 is moved. Is there any discussion on the amendment? No discussion on the amendment. Question being called. I'll say thank you for all of those that put a lot of hard work into this amendment. All those in favor of the amendment, please say aye.
Aye.
All those opposed, no. Proposed amendment number 2 passes. Any other discussion on the bill? Seeing none, no discussion on this very large bill. Thank you for all the work the committee has done during the interim. Thank you for all the work that the stakeholders have done during the interim and those that have given public comment. I think we can't do something like this without the work that we do during the interim. So I very much appreciate it. And with that, please call the roll.
Representative Chadwick.
Aye.
Representative Clouston.
Aye.
Representative Hornock.
Aye.
Representative O'Hearn.
Aye.
Representative Penn.
Aye.
Representative Trujillo.
Aye.
Representative Ward.
Aye.
Vice Chairman Yin.
Aye.
Chairman Zwanitzer. 9 ayes.
With 9 ayes, that bill passes and we'll move on to the floor. Who is for managing that? Will that be you, Chairman Zwanitzer?
I think I'll discuss with Ripon, Clausen, and Penn, and we'll either tag team it or I'll take care of it.
Great, you will take care of it as you are the chairman. Mr. Chairman, would you like me to hand this back over to you or would you like me to continue with House Bill 15?
What would you like?
I'm happy to keep going if you would like. And so with that, then we will move on to House Bill 15, Health Insurance Reimbursement of Overpayments. Chairman, would you like to introduce the bill or do you have someone else to do it?
I'm happy to, Mr. Chairman.
Please go ahead.
Basically, this came out of our first interim discussion when I think it was one of our good Senate colleagues said there is no limit on when claims can be considered for an overpayment and what that window might be, and they can just be held out there. I think under current law, they set up to 10 years. And so this just came out of that discussion. The bill provides a 2-year limit on the time that insurers can request reimbursement for overpayment of a healthcare claim unless that claim was fraudulent. And it's effective July 1st.
Great. Are there any questions for Chairman Zwanitzer on the bill before we move on? Great. Representative Hornak, please go ahead.
Thank you, Mr. Chairman. Just a question again on time frame. Why 2 years and not 3 or 5 or something like that?
Chairman Zwanitzer, if you remember.
Sure, Mr. Chairman, and other people can give you more education on it. 1 year seemed certainly not, I would say, fair to insurance companies, just when people do year-long procedures and billing cycles. 1 was much too short, but we didn't, I think, want to leave. I think there's some belief that you don't want these out there 3 or 5 years. You want to do your accounting, you want to close your books, you want to move on, and you don't want some claim 8 years later saying, hey, you actually owe me money because we overpaid you. It makes everybody angry and unhappy. So 2 years seem to be
The Goldilocks zone.
the Goldilocks bill. Exactly, Mr. Chairman.
Okay. Thank you, Mr. Chairman. Representative Hornak, any follow-up? We're also happy to have any people who give public comment to speak upon that number as well. Any other questions briefly? Otherwise, let's go to state agencies first, and then we'll go through all
Mr.
of
Chairman,
the other folks.
would it be possible to allow the general public to speak first?
Sure. I would be happy to let the general public speak first. It is normal procedure to let state agencies speak first, but I'm happy for the general public, and maybe they could raise concerns that we could have state agencies be able to answer afterwards. So if there are members of the general public, other than lobbyists, and then we'll go to lobbyists.
Everybody, there's a lobbyist to the press, I guess.
Happy to grant that request. Okay, let's have I will actually let all the members who are lobbyists who want to speak on the bill speak first, and then we'll go to state agencies. As much as I love you, state agencies, I will put you last this time around. Please, Ms. Roday.
Good morning. Thank you, Mr. Chairman, members of the committee. Again, Heather Roday from Blue Cross Blue Shield of Wyoming. Just wanted to testify in support of this bill and the 2 years. The comments that were made earlier by the good chairman captured it well, that 2 years is the Goldilocks zone. We understand that there is a need to put a timeline on it, and 2 years is where we're happy with that. So with that, stand for any questions.
Any questions? Great. Please, Mr. Hackman.
Thank you, Mr. Chairman. Hollis Hackman with the Wyoming Psychological Association. We very much support this bill. And Mr. Chairman, Representative Hornak, to speak to your concern about the time, we have providers that have received requests for reimbursement of overpayments that have gone beyond 3 years and beyond that. And it's really problematic for private providers to, pardon me, continue to operate their business and conduct the provision of mental health services when they're having to scramble around and maybe come up with a reimbursement from that many years ago. So for that reason, we're happy with a 2-year kind of a look back. And with that, I would stand for any questions. Thank you, Mr.
Any questions for Mr. Hackman? Great, thank you. Mr. Boley, please go ahead.
Mr. Chairman, committee members, Eric Boley with the Wyoming Hospital Association. We obviously fully support this bill. And I think 2 years is a good sweet spot. And I don't know if you remember this, but it was during one of our hearings. I can't remember where we were at. I think it was our second hearing. One of my hospitals got hit with a $750,000 bill that looked back almost 8 years. And when we talk about financial certainty, financial stability, that's a huge liability to be carrying. So we have requirements as providers to do timely filing and get our claims in and to get them paid. And I think it makes sense to have the ability to look back to a certain point in time. So 2 years just really seems like it's fair. We've done our part. Insurance companies have their part. The nice thing about this is if there's fraudulent claims going on, this doesn't affect it. And the full letter of the law can be thrown at fraudulent billers. So we would stand in full support and ask you to please pass this bill. Thank you. I'll answer any questions.
Any questions for Mr. Boley? Great. Thank you, Mr. Boley. Are there any other members of the public that would like to speak? Otherwise, we will go to state agencies, please. Any state agencies that would like to speak on this bill? State Medicaid, Mr. Grossman, please introduce yourself again and thank you.
Good morning, Mr. Chairman, Lee Grossman, State Medicaid Agent with the Wyoming Department of Health. I'm feeling the Valentine's Day love, even though you put us last. So happy Valentine's Day, members of the committee. I'll really echo my comments that I provided on the prior bill by virtue of this being in Title 26, no applicability for Wyoming Medicaid. But that being said, just hearing the question earlier about the look back period, our look back period in Medicaid is established in state administrative rule, and that's currently set at 6 years. So with that, happy to stand for any questions.
Any questions for state Medicaid?
Sure.
Chairman Zwanitzer.
Thanks, Mr. Chairman. So if we're changing the law for the private insurers to 2, any belief that perhaps we should change is that a nationwide standard, I guess is my question, or should we be looking at maybe updating it to something that's not 6 years? That does seem a little long.
Mr. Grossman, and to add on to that, is it in rule or is it in statute, that 6-year look back?
Mr. Chairman, first to your question, Mr. Chairman, that is in our administrative rules, not in state law. And then Chairman Zwanitzer, to your question, the federal minimum is 5 years. And as you heard from some prior testimony as well, what Medicaid is focused on is fraudulent activity. That's what we're investigating. Those investigations can and often do go on for multiple years. So that's why you see that 5-year federal minimum. Sometimes it can be a state entity, sometimes it can be a federal entity conducting that investigation. And at the end of the day, the purpose is to recoup public funds that were reimbursed for any fraudulent activity.
That makes sense to me. Any follow-up? Nope. Any other questions for state Medicaid? Thank you very much, Mr. Grossman. Any other state agencies that would like to speak on this bill? I'll give one last chance for public comment on this bill. Is there anyone online that would like to give public comment on this bill? Nope. And then I will be closing public comment on this bill. Is there any, what is your pleasure on House Bill 15? Moved from Representative Chadwick, second from Representative Ward. Are there any amendments or discussion on the bill? Seeing no discussion, we will call the roll. Thank you.
Representative Chadwick.
Aye.
Representative Klauston.
Aye.
Representative Hornock.
Aye.
Representative O'Hearn.
Aye.
Representative Penn.
Aye.
Representative Trujillo.
Aye.
Representative Ward.
Aye.
Vice Chairman Yin.
Aye.
Chairman Zwanitzer.
Aye.
9 ayes.
So House Bill 15 will move to the floor. I will give the chairmanship back to Chairman Zwanitzer and he can talk about what he'd like to talk about.
Just like to say how great it is to have 2 9-0 votes on bills to start off our 2024 year. Did anybody want to take the lead on floor managing House Bill 15? Certainly letting anyone have it should they want it. Representative Klauston? Sounds agreeable? Okay. It could be up as early as today, I'm just letting you know. So I'm doubting prior auth will come up today, but I think 15, if I'm guessing, could be one of those that sneaks through quickly. We are going to do Certificate of Need Friday, it looks like, for sure. I know there will be some people here to testify on that. Any other business for the committee this morning? Seeing none. Look forward to 3 more exciting meetings for House bills before cutoff here. So we'll give you back 15 minutes of your morning. See you at 10 o'clock. We're adjourned.